When I wake up in the morning, I never eat food right away. I take the time to kind of get ready. If I take a shower, get dressed, I'll catch up with some emails or whatever it is.
The
I
word fat often triggers a powerful negative emotional response.
A 68-year-old woman named Margaret stands quietly in her kitchen brewing her morning coffee. No,
I don't belong to the Clean Plate Club. I quit that a long time ago. I don't like food waste, but I'm going to only eat enough to.
Here's something that might catch you off guard. Research indicates that more than 90% of healthy individuals over the age of 75 who undergo a full body scan will receive results showing something abnormal. But here's what's truly striking. In the overwhelming majority of these cases, those findings are completely benign and would never have created a single health issue throughout their entire lifetime. Yet what follows? Worry, additional testing, tissue samples, and occasionally operations, all targeting conditions that would have remained completely silent and harmless. I'm Dr. William, and throughout my medical career, I've witnessed this situation unfold more times than I can count. In this video, I'm going to walk you through 5 routine medical screenings that, once you've passed age 70, frequently end up causing more damage than benefit. Let me be clear, this isn't advocating for avoiding healthcare altogether. This is about making intelligent, thoughtful choices regarding your healthcare. So if you're 70 or older, or if someone close to you falls into that category, please keep watching. What I'm about to explain could spare you from unnecessary medical interventions, significant complications, and immense emotional distress. Before we begin, I need to emphasize something with absolute clarity. I am absolutely not telling you to refuse all medical attention or claiming these screenings never serve a purpose. What I'm telling you is that as we advance in years, the equation shifts dramatically. What benefits you at 50 can potentially harm you at 80. Medical screening fundamentally involves weighing advantages against disadvantages, and those scales tip as we grow older. Every single test I'll discuss today absolutely has legitimate applications in medicine. I've personally prescribed these very tests myself when circumstances warranted them. But ordering them automatically as routine procedure simply because someone has reached a particular birthday, that's precisely where complications emerge. Let's begin with number 1, comprehensive body imaging. You've likely encountered promotions for these. Get a complete view of your internal health. Detect issues before they develop. Premium wellness facilities charge substantial fees for these thorough scans, promising tranquility and reassurance. They sound amazing, don't they? Who wouldn't want to identify every possible concern immediately? The challenge is that these imaging techniques excel at detecting things. And within medicine, detection doesn't always translate to benefit. Here's what the evidence reveals. Research indicates that approximately 40% of symptom-free adults undergoing full-body MRI examinations will show some anomaly requiring further investigation. Many of these represent what medical professionals call incidental findings, unexpected discoveries that would never have created health problems: a minor cyst in your kidney, a tiny spot in your lung, a non-cancerous growth in your liver. These appear regularly as we age. Consider them equivalent to the external signs of aging showing up internally, perfectly natural aspects of growing older. However, once detected, they cannot be undetected. Suddenly, you carry a label indicating an abnormality. Your physician feels compelled to investigate further. That could involve additional imaging months later. It might require tissue sampling, bringing its own dangers like bleeding or contamination. In certain situations, it results in operations or interventions targeting conditions that would never have impacted your well-being. This chain reaction of procedures begins with a single scan that had no genuine medical justification initially. And when that scan involves CT technology rather than MRI, an additional worry emerges: radiation exposure. A solitary full-body CT scan can expose you to radiation comparable to hundreds of chest X-rays. Although the cancer risk from one scan remains minimal, it isn't non-existent. Why voluntarily accept that danger without clear medical justification? So, what alternative approach should you take? The solution involves a complete geriatric evaluation. This isn't a brief checkup. It represents an extensive assessment concentrating on elements that genuinely influence health and life quality at your stage of life. It involves examining your physical capabilities. How's your equilibrium, your hand strength, your walking speed? These straightforward measurements predict your well being far more accurately than any imaging study. It includes examining all your prescriptions. Seniors frequently manage 10 or more different medications, and regularly, drug side effects get misinterpreted as fresh health issues. It incorporates lifestyle elements, nutrition, rest, physical activity, social relationships. These constitute the genuine building blocks of wellness. A thorough evaluation provides you with practical knowledge. It shows you concrete steps to preserve wellness and self sufficiency. A full body scan simply produces worry and triggers a chain reaction of additional procedures. Number two on our list, brain imaging for minor memory issues. This occurs frequently. An individual over 70 misplaces their keys or momentarily forgets an entertainer's name. Their relatives become concerned and push for brain imaging to eliminate Alzheimer's possibility. The motivation is positive, but the outcome frequently creates difficulties. Evidence demonstrates that 94% of individuals over 75 undergoing brain MRI will show irregular results. Consider that statistic carefully, 94%. These findings might include elements like minor brain shrinkage, which essentially indicates your brain has naturally reduced somewhat with time. That's entirely normal. Or white matter changes, small spots on the brain that appear alarming, yet appear in over half of older people and typically indicate nothing beyond years of somewhat elevated blood pressure that wasn't ideally managed. The difficulty arises when, at age 78, your imaging report references cerebral shrinkage and white matter changes. It sounds terrifying, even though to an experienced physician that report essentially reads this brain belongs to a typical 78-year-old individual. To you and your loved ones, it sounds like a dementia diagnosis. That fear can transform everything. Individuals begin questioning themselves. They pull back from activities. They lose faith in their mental abilities, all triggered by imaging findings completely unrelated to their genuine cognitive performance. And here's the essential point. These imaging results don't alter treatment approaches for minor memory concerns. No medication exists that reverses typical age-related brain modifications. Therefore, the scan provides no benefit to you. It simply creates anxiety. The superior approach involves straightforward cognitive evaluation right in the medical office. Assessments like the Folstein test or the MoCA require approximately 10 minutes. They genuinely evaluate how your brain operates, not just its appearance on images. If the evaluation shows normal results, you and your family can feel reassured. If it indicates concerns, then we investigate correctable causes. And numerous correctable causes of memory difficulties exist. Vitamin B12 shortage appears frequently and resolves easily. Thyroid conditions can create mental confusion. Depression among seniors regularly manifests as memory complaints. Sleep apnea can deprive your brain of oxygen overnight and impair recall. Numerous prescriptions, particularly sleep aids and anti-anxiety medications, can fog thinking. We should examine all these possibilities before even considering brain imaging. If cognitive testing reveals progressive deterioration over time and we've eliminated all correctable causes, then imaging might become appropriate as part of a thorough assessment. However, for routine forgetfulness, brain imaging isn't the solution. Number three, routine cardiac stress evaluations. This catches people off guard. Isn't it beneficial to understand your heart's condition? The challenge involves cardiac stress tests in symptom-free older adults producing extremely frequent false positive results. That means the test indicates a problem when none actually exists. Why does this occur? As we age, modifications happen in the heart and blood vessels that can influence stress test outcomes without indicating dangerous blockages. Factors like extended periods of elevated blood pressure, heart muscle thickening, or electrical pattern changes can all generate abnormal stress test findings, even when your coronary arteries remain clear. So, what follows a false positive stress test? You're referred for additional testing. Frequently, that involves cardiac catheterization, where a flexible tube travels through your arteries to reach your heart. This represents an invasive procedure carrying genuine dangers: bleeding, infection, arterial damage, kidney complications from the contrast material, and frequently, the catheterization reveals perfectly healthy arteries. The stress test was mistaken, but you've endured an unnecessary procedure with unnecessary danger. Even more concerning, occasionally the stress test itself can create difficulties. Although uncommon, stress tests can provoke dangerous heart rhythms or even cardiac events in certain individuals. For someone experiencing symptoms like chest discomfort during activity, a stress test makes complete sense. We need to understand what's happening. However, for someone without symptoms who manages stairs and walks energetically without difficulty, you're already passing a stress test daily. Your routine activities demonstrate your heart functions adequately. If you want to understand your cardiac risk without stress test complications, a superior alternative exists: coronary calcium scoring. This represents a brief low radiation CT scan measuring calcified plaque within your arteries. A 0 score indicates extremely low heart attack risk in upcoming years. An elevated score signals the need for aggressive prevention through medication and lifestyle modifications. It provides information without the chain reaction of interventions following a false positive stress test. Number 4 involves colon examination after age 75 to 80. Now, I must emphasize something clearly. Colon examination represents an outstanding screening method. I strongly endorse it beginning around age 45. It preserves lives by detecting and removing precancerous growths. My concern involves continuing routine colon examinations into advanced years when previous screenings have remained clear and you experience no symptoms. Here's the reasoning. The advantage of colon examination involves preventing colon cancer that would develop 5 to 10 years later. However, if your life expectancy falls below 10 years, whether due to age or additional health conditions, you're unlikely to gain from screening. Meanwhile, colon examination risks increase with age. The preparation process alone can endanger older adults. It requires consuming substantial quantities of laxative solution, potentially causing serious fluid loss and mineral imbalances. For individuals with kidney disease or cardiac failure, this can provoke serious complications. The sedation administered during the procedure carries elevated risks for older people, including confusion, breathing difficulties, and dangerous blood pressure drops. Additionally, there's the perforation danger, a colon wall tear. Overall, perforation occurs in approximately 4 per 10,000 colon examinations. However, in individuals over 75, particularly those exceeding 80, the risk increases. The colon wall thins with age, making tears more probable. A perforation constitutes a surgical crisis. It typically demands major surgery, occasionally resulting in a colostomy pouch. For an 80-year-old individual, this could mean losing independent living capability. Major medical guidelines acknowledge this shifting risk-benefit calculation. The United States Preventive Services Task Force suggests screening decisions between ages 76 and 85 should involve individualized consideration of overall health and prior screening history. They advise against routine screening after 85. This doesn't mean ignoring the colon after 75. It means transitioning from screening to watchful awareness. You must recognize warning signals and report them immediately. Persistent bowel habit changes, blood in stool, unexplained weight reduction, newly developed anemia, persistent abdominal discomfort. If any of these appear, age becomes irrelevant. Investigation becomes necessary. Prevention continues to matter too. A high fiber diet becomes your colon's greatest ally. Fruits, vegetables, whole grains, legumes, and lentils nourish the beneficial bacteria in your digestive system that generate cancer-fighting compounds. This nutritional approach proves much safer than repeated colon examinations and benefits your entire body, not just your colon. Our fifth and final screening involves PSA measurement for prostate cancer in men over 70. This topic has generated controversy for years, understandably. The prostate-specific antigen, or PSA test, has produced an epidemic of overdetection and overtreatment. Here's what distinguishes prostate cancer from numerous other malignancies. It progresses very slowly in most men, particularly older men. Postmortem studies reveal that up to 80% of men in their 80s have prostate cancer at autopsy, but most died alongside it, not because of it. It remained present, never creating difficulties. The challenge involves the PSA test's inability to differentiate between aggressive malignancies needing intervention and slow-growing cancers that will never create problems. Consequently, we detect all these cancers, and once someone hears the word cancer, they want it treated. But prostate cancer treatment carries significant consequences. Surgery can create permanent bladder control problems and erectile difficulties. Radiation therapy produces similar issues in many men. These side effects profoundly impact life quality. The United States Preventive Services Task Force examined all available evidence and determined that for men 70 and older, the potential harms of PSA screening exceed the benefits. The probability of detecting a cancer that would actually prove fatal is extremely small. The likelihood of overdetection and harmful treatment is substantial. They estimate that overdetection rates exceed those in men in their 50s by more than 15 times for men over 85. What about family history or additional risk elements? Those certainly matter and might shift the balance towards screening even after 70. However, this should involve discussion, not automatic testing. A thoughtful conversation between you and your physician about actual numbers, genuine risks, and what matters most to you personally. For men diagnosed with very low grade prostate cancer, active monitoring often represents the optimal choice. This involves observing the cancer without treating it unless it demonstrates signs of becoming more aggressive. Regular PSA measurements and periodic biopsies keep watch, but you avoid life altering treatment side effects for a cancer extremely unlikely to harm you, so there you have them. 5 screenings that, after age 70, frequently generate more difficulties than benefits. Full body scans detecting harmless irregularities and triggering chains of unnecessary procedures. Brain MRIs for minor memory concerns creating anxiety without providing useful information. Routine cardiac stress tests producing excessive false positives in older adults. Colon examinations after 75 or 80 when previous screenings were clear. And PSA testing in men over 70 leading to overdetection and overtreatment of slow-growing prostate cancers. What common thread connects all these? They all represent searching for problems in individuals without symptoms. And as we advance in years, that type of searching becomes progressively less likely to benefit us and increasingly likely to harm us. Let me restate. This isn't about avoiding medical attention. It's about intelligent medical attention. It's about concentrating on what genuinely enhances health and life quality. A comprehensive geriatric assessment outperforms a full body scan every time. Brief cognitive testing outperforms brain MRI for minor forgetfulness. Recognizing warning signals and maintaining healthy habits outperforms routine colon examinations in very elderly individuals. And honest discussions about goals and priorities outperform automatic PSA testing. The objective of healthcare after 70 shouldn't simply involve detecting every possible issue. It should involve preserving function, independence, and life quality. Sometimes the most valuable action a physician can take is declining to order a test, sitting with a patient and genuinely hearing them, focusing on what truly matters to that individual, helping them remain active, connected, and engaged with living. If one message deserves your attention from this discussion, it's this. You possess the right to question. When a physician suggests a test, you can ask why. What will we do differently based on the results? What are the dangers? What happens if I skip this test? These aren't confrontational questions. They represent inquiries from an informed patient taking ownership of their health. Medical care should represent partnership. You understand your body, your values, and what matters most to you. Your physician understands medicine. Together, you reach decisions appropriate for you as an individual, not as a statistic and a guideline. So, the next time someone recommends one of these screenings, pause, reflect, inquire, reach an informed decision, because the objective isn't simply extended lifespan, it's living well with dignity, self-sufficiency, and fulfillment. And occasionally, the optimal way to protect that is declining an unnecessary test. Thank you for watching. If you found this information valuable, please share it with others who might benefit. Subscribe to the channel for more evidence-based guidance on staying healthy as we age, and please leave a comment below. Have you ever felt pressured into a medical test you weren't certain about? How did you handle it? I genuinely appreciate hearing your experiences. Until next time, stay healthy, and remember, intelligent healthcare means recognizing when to accept and when to decline.